So let's talk about postpartum depression, which is the most commonly spoken about mental health disorder that is associated with postpartum recovery. Now, what I want to let you know is that the statistic for postpartum depression and women who deal with this during or after pregnancy is 15%. That is a significantly high number in accordance to women who are having babies. Now, what are some of the symptoms? So you have feelings of anger, irritability, you lack bonding with your baby, and you have really little to no interest in bonding with your baby. It can be triggered through breastfeeding. There's a lot of really high risk factors. So things like poverty. Teenage moms actually experience a higher percentage than normal women who are having babies of postpartum depression. There is honestly a lot of risk factors. Lack of help or support when it comes to having your baby and, raising your baby. Inadequate marriage support. You have a rocky relationship with your husband. Things like that. Now let's talk about postpartum anxiety. About 6% of pregnant women and 10% of women who have already had their baby experience postpartum anxiety. Now, postpartum anxiety can be alongside postpartum depression, or it can be on its own as well. There are two forms of postpartum anxiety. There's generalized postpartum anxiety, so GAD, kind of like GAD. And then you can also have postpartum panic disorder as well. So the symptoms that are associated with postpartum anxiety is lack of appetite or being able to sleep. So a lot of sleep and appetite disturbances. You also have really racing thoughts. You constantly feel like you or your baby are going to be either harmed or something really bad can happen. And it's just really crippling for me when it came to postpartum anxiety. So I've had all 4 of these mental health disorders when it came to postpartum mental health disorders. So when it came to postpartum anxiety for me, I actually struggled a lot with leaving the house. I was actually basically stuck in my house for over a year, and it was only my best friend who got me out of the house and was able to help me to overcome that postpartum anxiety. So it's really important to actually find someone that you trust that's not going to judge you, that will get you out of the house and make you do things. So, but without judgment, because they're going to understand that it's really difficult for you to do that. So, definitely try and find someone that you can trust. That is the best way that I would have to say to overcome postpartum anxiety. The third mental health disorder associated with postpartum is postpartum OCD. So what is postpartum OCD? Essentially is racing compulsive thoughts, overcleaning, things like that. Like for me, when it came to OCD, postpartum OCD, I always constantly thought that my daughter needed a diaper change. And even right now, I still struggle with a lot of these thoughts, but it's been a lot easier for me to manage. And another thing is that not just women after pregnancy experience this, about 3 to 5% of men can also experience postpartum OCD as well. Now, postpartum PTSD is really one of the more difficult ones that you are going to deal with. It's going to really hinder you a lot in terms of your ability to bond with your baby, ability to do anything for yourself. And the risk factors behind this are essentially, if you have a history of trauma. Like for myself, I am a survivor of sexual abuse, and so when I had my daughter, it was really difficult for me to be like, I had racing thoughts, and there was a lot of things associated with the pregnancy, and honestly, it was a really dark time for me. So I'm really grateful that I've been able to overcome this. This is another mental health disorder that I really struggled with. Essentially, you lose all complete sense of reality. You hallucinate a lot of the time. And this can happen just a few weeks after birth. And it can come on suddenly. One of the main reasons why a lot of these mental health disorders come into play after postpartum is that your health is actually not really good. So essentially, when you have your baby, they take everything from you. And the number one thing that controls a lot of our hormone release and storage, and actually creates a lot of our hormones as well, is our gut health. And so for me, when I learned that gut health was the most important thing to controlling my mental health disorders, I was absolutely blown away. This education really changed my freaking life. And so I have recently started taking a product that is absolutely amazing and delicious, and it's called Happy Juice, and it actually helps to regulate my hormones. One of those really main hormones when it comes to dealing with stress is cortisol, and cortisol can really affect a lot of your body. And so when I was able to start regulating my cortisol as well as my estrogen and my progesterone, it really made a huge difference for me. And that is honestly what started the catalyst to me healing through my postpartum depression and anxiety and PTSD and psychosis and OCD. And I honestly really would highly suggest that anyone who is dealing with mental health in general or really struggling with their postpartum recovery, take a look into Happy Juice. And so I've included a link below along with a couple other links for you to check out. And so if you want to, go take a look at those, but definitely like, follow, and subscribe to my page, because I have a lot of really amazing tips that will help you to essentially overcome a lot of your mental health disorders. And I will not say heal, because I am not going to do any medical claims whatsoever, but I do know that it will help you, because natural supplements are the way to go, especially after you've had a baby. So yeah, I hope you guys found some value, and if you have, definitely hit that like button, but I hope you guys have an awesome day.